Everybody. My name is Trisha Badi, and I work at the Southwest Florida Community Foundation. I'm the head of social impact and connectivity here. Today, we have the great and distinct honor of to talk today about COVID and health and safety. And we have a great person here today from Florida Blue, Dr. Kelli Tice, who's going to go over some of the do's and don'ts and understanding a little bit more of safety in the workplace as well as for your employees and employers. But first, I just want to let you know this is our Thrivability series, and our Thrivability series is really dedicated in bringing gurus from our community, experts and individuals who can really kind of help build capacity in our community. And because right now we are kind of in this pandemic and there's a crisis, we're really leaning into our healthcare community to really help and frame the needs that we can do and the ways in which we can help our community. So Dr. Kelli Tice is the Senior Medical Director, and she was a former practicing primary care physician, and she formerly worked in leadership in the role of the Florida Department of Health. So we have an expert, and I'm so honored that you're here today. So thank you for coming, and feel free to just start.
Thanks for having me. This is, first of all, I want to express my gratitude for what it is that you're doing. One of the challenges with COVID-19 is that it is changing so rapidly. What we know about it and our approach to keeping ourselves safe has changed over the last several months. And so as a clinician, it has become difficult to ensure that people have the information they need in order to keep themselves safe. And I think I feel that from folks. Just tell me what to do, and then I'll go do that. But the guidance has changed, and so I applaud you for positioning yourself in this space to be sure that folks have the information they need to, again, keep themselves, their families, and our community safe. So really happy to be with you today.
Yeah, no, we're glad you're here as well. We're doing our best, and we're all trying to do our part for sure.
Right. So in terms of the office spaces, I think there are many questions, and I get them all the time. What can I do when I have to go back to work? How do I keep myself safe? And I think that we need to look at that from two perspectives. I mean, for employers, for instance, you want to be sure that the space itself is safe. So most employers need to be paying attention to how their spaces are being sanitized. Right, so your daily cleaning needs to be heightened. You're going to pay closer attention to your high touch surfaces, anything that has to be shared by employees who are coming in on different shifts, or maybe sharing office spaces on off days. Those kinds of things. Those things need to be really addressed frequently. You may want to even consider giving employees their own sort of set of disinfectant wipes and other things like that, so that they can keep their workstations sanitized in between uses by others. If there's a common area or a small area in your facility that you really won't allow for appropriate social distancing, go ahead and close those. Your smaller conference rooms, some have chosen to close their cafeteria area down or their break rooms, just to ensure that you're not providing opportunity for employees to kind of gather a little too closely and increase the risk of disease transmission. And then I think the other thing that's important for employers is to be sure you communicate what you're doing, right? Employees have questions and they want to feel safe. And so talking about what you're doing, using some signage to kind of talk about, the things that are in place, and put reminders in place for the things employees should be doing, washing their hands frequently, not touching their face, avoiding unnecessary touching of high-touch surfaces, those kinds of things. All of those things kind of work together to make the workplace as safe as it can be while we wait for good treatments, a vaccine, and other more definitive things against COVID-19.
Yeah, the right? The crowds, close contact, and confined spaces. Yeah, that's really good and helpful. So what can you do to your office area to make it safer for employees and those that they serve?
One of the things I encourage employers to do is first look at spacing, right? And so should you reconfigure setups in order to be sure that employees can stay 6 feet apart? And if it can't be reconfigured, you may need to alternate or adjust your floor plan so that spaces that are too close together just aren't utilized, right? So if you have a cubicle situation, you may want to use every other rather than those that are side by side. You think about things like installing hand sanitizer stations that will allow quick access for employees to sanitize their hands when they can't get to soap and water to do the necessary washing. You want to be sure that you're thinking about what I call pinch points, right? So where in your company, where in your business, are there places where you just can't keep appropriate distancing? Elevators, stairwells, hallways, those kinds of things. And depending on the number of employees you have, maybe you want to think about controlling traffic flow in some manner. Maybe some areas you want to close down altogether just to, take that risk, completely out of the way. Or you may just want to sort of use those opportunities to really communicate to employees what they need to do to stay safe in those settings. How do you come through the cafeteria line, for instance? Where can you sit and eat? Those kinds of things.
Yeah, that's extremely helpful. What do you think about resources that you could provide your employees? There's many nonprofits who are trying to look at incentives and things to be helpful to their employees. So like what could you provide your employees to enhance their health and safety?
So, and this is really important. What we found as we have studied these cases over the course of the last several months and then begun to manage investigations related to cases is that many folks don't have what they need in order to be safe. So we say, wear a cloth mask, but there's some folks we found that just don't have access to that. And so my first recommendation would be to stock up on personal protective equipment that you might use to help employees be and feel safe while they're in the performance of their duties. That might be masks. If you're in a situation where, again, you're touching surfaces or materials that are handled by large numbers of people, you may include gloves. If the bulk of their work is done in a setting where they have to be within 6 feet, then you want to think about barriers, those kinds of things. And so really, start thinking about what you can begin to gather that you would want to deploy in your staff to be sure that they feel safe and have the equipment in order to be safe in the performance of their duties.
Yeah, the being safe part, right? Like feeling safe. Yeah.
Yeah, it's critical, and I think in a situation like this where there are many still unanswered questions, that feeling of safety, I have what I need in order to do my job in as safe a manner as possible, really goes a long way. What we're hearing is that many employees they're stressed by this, and it becomes a source of grave concern for them because they leave the workplaces and they go to their homes. And so they're worried about the risk that is posed to their families and loved ones.
Yeah. Yeah, no, absolutely. So what about from the employer standpoint? Like what is the monitoring of your employees for COVID symptoms? What are the kind of things you should be thinking about?
Well, I think you have to make a decision just how involved you want to be in that, because I think there are a number of resources and tools that exist to do this. But to put it simply, you need some process of ensuring that employees who are ill, so themselves having symptoms of COVID-19, employees who have been exposed, so they have a loved one or a family member or someone else who has a diagnosis of COVID and they've been in close contact with them, you want to be sure that they have a way of reporting that, like you can identify that. And how you accomplish that really depends on the business. There are some that are using digital tools to employees sort of go to an app and fill out this information on a daily basis. There are others who use questionnaires. There are others who screen every time they enter the facility, and that can happen plus or minus temperature screening. I think all of us by now have had the experience in some business or another where you go in and they'll scan your forehead, right, for the temperature. Is very interesting. There's some employers who are choosing to do that as well. Others who don't want to do that have asked that employees monitor their temp. So maybe do a test every day. I don't have a temperature that's over 100.4. I don't have new respiratory symptoms, headache, sore throat, the COVID list. and I haven't been exposed to anyone who has COVID, thus, attesting that they're safe to enter the facility. So the screening piece needs to be sorted out somehow, and there are lots of templates and tools for that piece of it. Bigger than that, though, is creating an environment that makes employees comfortable in the reporting, right? So we find that there are those who are reluctant to report when they're ill because they need to work, right? They need to be there. And so you want to be sure that you're working to build rapport and maintain rapport with your employees so they feel comfortable sharing when they're ill or potentially at risk. And that means you need to take a look at your leave policies, those kinds of things that might influence that. So I think that's a big piece of it as well. And then thirdly, it is critical that once you identify someone who either has had an at-risk exposure or who is symptomatic themselves, you have to have a plan for how to address that in the workplace. And typically that looks like, sort of immediately asking them to return home or not enter the work site, ideally. And then work according to the CDC guidance to then manage your facility. You need to do a deep clean in the area that employee has been in the previous 48 hours. And identifying members of your team that they maybe have been in close contact with, who might also need to be potentially excluded if that employee is determined to be positive. And I want to define close contact, okay? Close contact is 15 minutes or more within 6 feet, with or without a mask, okay? So, and that's the CDC description. And so it should be fairly easy based on your work processes to identify those employees who meet that definition.
Yeah, that's very helpful information. Thank you. What are some of the, so there's people that are generally more at risk than others when it comes to some of the conditions with COVID. So what are some of the employees, from an employer standpoint, that you need to be a little bit more concerned about? What are those individuals look like, or what are the concerns that they may have from a health risk?
Sure, and this is an important thing, and it's actually quite delicate, right? There's one of the first things I think you learn in terms of interacting with employees is not to sort of query them about their personal health history. But this is a situation where someone who has a history, for instance, of asthma or other lung disease, COPD, someone who has heart disease, including hypertension or high blood pressure, folks who have sickle cell disease, chronic kidney disease, those who are diabetic, especially if their blood sugars are not well controlled, anyone who has a weakened immune system, which can be, that can result from multiple things, or someone who's severely obese. Like all of those things put folks at not necessarily increased risk of getting COVID, but certainly it puts them at risk of having more significant impacts. So becoming more ill and perhaps even requiring hospitalization in order to manage it. So, so my recommendation is, one, as an employer, be knowledgeable of that. Publish that information, put that information out to your employees so they know their risk. And so without necessarily having them disclose where they fall on the list, make it clear to them where the increased risks are, and demonstrate for them a willingness, where possible, to put them in lower risk environments. So if there's an opportunity, for instance, for someone who might fall into one of those categories to work in more of a remote capacity, or work at an off time where they interact with fewer people, things like that, I think would be key. Now, having said all of that, there will be environments where that's just not possible to offer, but it is important that we make sure that employees know that they're at increased risk, and then we can allow them and their colleagues to sort of really adhere to the social distancing guidance and the other health measures that need to be put in place to keep them safe.
Yeah. So a lot of the information that you're referring to with this information is, this would be the CDC. Is that correct? Is that where you would get this information to disseminate that? Is that correct?
Yes. The Center for Disease Control and Prevention has just a huge collection of resources and guidelines that are useful for businesses, and it can address everything from testing and what the importance is of that, or the value is of that information. It's got information about things you need to do in your work sites. And so I encourage people to just kind of go and take a look. Warning, it can be a bit overwhelming. It's a great deal of information. But it's categorized fairly well, so that if you, for instance, just go and look at the business and workplace guidance, there are a number of resources there that I think will be useful for folks.
Yeah, that's really helpful. I know that there are a lot of the organizations are big or small and may not have an HR. So, knowing where to go, to kind of that easily accessible stuff, I think is really helpful. So this has been extremely helpful, and I'm very appreciative. Is there anything else additionally, just from the flow of the conversation, you think that might be something additionally you want to add? Because this is a lot of information, but it's a good information for people to understand, given the uncertainty and the unknowing information that people have felt. So.
Sure. I think I would just add just a couple of additional resources. We talked about cdc.gov, where you can get some of the COVID information. You can go to floridablue.com/COVID-19. We've got some resources we've pulled together there. And you can always go to the Florida Department of Health website, which is flhealth.gov. You may find yourself in need of, a sign to print, or something like that, and each one of those sites has some documents that might be useful for posting or that sort of thing. We can get through this. I think what you're doing and what many others have already done and put in place for this, if we all continue to kind of work together and keep communicating about this, we will continue to make progress. We've come this far. So I'm hopeful, I'm optimistic that we're going to continue to make good, positive forward progress.
That's love going on an optimistic note and being hopeful. So I think I don't have any more questions. I'm just very thankful for you, and I'm also thankful for Florida Blue for the opportunity to, as a resource for us to be able to go out to the community and give this information. So I just wanted to tell you how thankful we are, and I appreciate your knowledge, and it's warming to hear the sentiments of hope. So I'm very appreciative.
Thank you.
All right, listen, have a great one. Thank you so much.